So, very good evening, everyone. Today, we have selected a topic which is very relevant nowadays in the obesogenic environment or where there are too much of comorbidities. That is awareness about alcohol consumptions. So, this is actually the topic is selected by one of our speaker today, that is Ranjeeta, and she has nicely planned this topic. So, apart from Ranjita, Fatma has coordinated it with her. And few days back, Moumita and Sushma also joined this topic. And hope you will learn many things from this topic. We will get to know many things from what is alcohol consumption, what can be the recommended doses in the sense that those who are already consuming alcohol. So in a nowadays, that is, people are very much fascinating about taking alcohol. In the young generation, sometimes the peoples have started and they get addicted. In the young generation also, we can find that if the person is in stress, in the depression condition, the people are taking alcohol, and there are high chance of suicidal attempts in India, and even the deaths due to alcohol consumptions. So alcohol in somehow is always dangerous, though we will emphasize some of the health benefits of alcohol as well, where it is good or bad. And we will get to know many intricate. And before this presentation, just I today joined with them and I saw the presentation. I was not an aware about many facts which they have included in these presentations. So another fact is when the in the corporates, people usually used to take occasional drink, what we called occasional drink, like weekly once, weekly twice, monthly once, but they do not know the restricted amount. If you are taking once, if you are taking every day, the limitation should be like you cannot over drink. Like a person is saying that एक दिन तो पीते हैं, so हम 10 पेग ले लेते हैं. That means the person is in the dangerous condition. Maybe the person is having fatty liver, maybe the person is having borderline diabetes, maybe the person is already having diabetes, the person is unknowingly uh, doing harm to his system. So many things we need to know about alcohol, because alcohol we cannot parallelly compare with smoking. Both are addictions. As a dietitian or doctor, we find any comorbidities, we used to say quit alcohol. But when we recommend, we say about alcohol, we say limit alcohol. We do not say in one go stop alcohol. So now I will go to the introduction of the speaker. One by one, we have 4 speakers today. So our first speaker is Miss Ranjeeta Bose, who is pursuing is pursuing now. She is already a BSc student, and she has done a fantastic job today. Food and nutrition from Sharadama Girls College, completed 6 months. Medical nutrition therapy from Cognized Nutrition, and also completed one course which is done with collaboration with Cognized Nutrition RB Diet Clinic, that is obesity course. The management, how to management obesity. Fatma Firdos is pursuing MSc in Applied Nutrition from All India Institute of Hygiene and Public Health, completed BSc in Clinical Nutrition and Dietetics from Gokhale Memorial Girls College, Kolkata, where she get to know about me and Cognized Nutrition, and she is attached nutrition from her BSc days. She has completed also 6-month medical nutrition course from Cognized Nutrition, and now she is already the life member of this family. Completed diabetes educator course from National Diabetes Educator Project. She is very much active and passionate about learning, and she is also a very good nutritionist. Moumita Shaha is pursuing food and nutrition from the Biharilal College under the University of Calcutta. She has completed her food and nutrition in Maharani Kasheshwari College, that is also under Calcutta University, completed 6 month medical nutrition therapy courses from Cognized Nutrition, and also a diabetic educators from Dr. Utsobasu's clinic. Dash has completed BSc from University of Bardhaman in nutrition, completed MSc from CARE Chennai in human nutrition, completed internship from FMRI Gurgaon, completed internship from NMH Howrah, dietitian at Paras Hospital, Gurgaon. She is now placed in Gurgaon. She is the life member of Indian Dietetic Association. She has completed the Diabetes Educator course from National Diabetes Educator Project, and she has also completed our Cognized Nutrition Medical Nutrition Therapy course. So now we are moving to the topic. I invite our first speaker, and even during introduction, I requested all the speaker to switch on their camera if it is possible for, and then one by one you can start with the presentation. So I like to highlight this. Sushma, you can switch on your camera, please. Sushma Dash will describe about the statistical data of India and the definition of alcohol and types. Ranjita will be telling us about the binge drinking, all about the blood alcohol level, what is BAL. Fatma will be telling the metabolism of alcohol, different calories, because first thing patient when come to us asking about the calories of the alcohol. So what alcohol, which alcohol they can take, what alcohol they are currently taking, etc. Factor contributing to alcohol consumption. किस परिस्थिति में आके they are taking alcohol. Ranjita Bose will talk about the effect of alcohol, short-term effect, long-term effect, and how alcohol affect the brain, relation between alcohol and sleep. So Moumita will be telling about the very interesting part that during pregnancy, fetal alcohol syndrome, and some take-home messages for the people who are consuming alcohol. And after that, we will move to the Q&A session, that is very frequently asked questions, and many things can come in your mind. So we will try to answer whatever will be feasible for us. So welcome, Sushma. You can start the topic discussion.
Thank you, sir, for your kind introduction, and I am welcoming all whoever coming here and giving us time. So today is our very important topic about alcohol consumption. First, we'll go about the statistical data. Then we'll move forward about the what is the adverse effect of the alcohol consumption. So from this slide, we can see that overall India 9.91% whose age is over 15 years are taking alcohol in regular basis, which is not good at all. So from the next slide, we can understand which state is highest in the number. Next slide, please. From this bar diagram, we can understand that Arunachal Pradesh, Sikkim, Telangana, Andaman, Nicobar, Iceland, they are so far on, they are taking alcohol in very large amount. Like Arunachal Pradesh is the highest in the number, that is in 38.42%. Next slide. So this is very old scenario of our Indian scenario, or worldwide also is a old scenario, like teen drinking is not acceptable at all. In 2019 data, we can see that 100 in 100, 2 of adolescents, which age is 12 to 13, reported drinking alcohol. And thank you, sir, for that. So which are taking alcohol, and among them 101 engage in a binge drinking. So a second group we are taking is the 16 to 17. Here also we can see is the most this is the all old scenario, that 1 in 5 reported drinking alcohol and 1 in 10 reported binge drinking. So when a teen drinking alcohol, it would be our old scenario, because we can see from the next slide that what is the adverse effect of underage drinking. So from this pie chart, we can see that underage drinking related to death. We can see that 32% of people are dying because of the traffic death. Homicides is 30%, suicide is 14%, other poisoning and alcohol poisoning is the 9%, both are 9%. Drowning is 3%, fire 1%, falls 1%, and other also 1%. So we can see that teen drinking is a real problem of our society. This is the wine consuming cities. We can see that Mumbai is the highest wine consumer in our India. Then Delhi, Bangalore, Goa, and rest of the India only is 20%. They are taking wine regular basis. So here is the main slide. What is alcohol? Alcohol is a chemical substance which contain ethanol. So how ethanol created? Ethanol created from the process called fermentation. So fermentation is a anaerobic process, which means it's not needed oxygen, and the energy is created from the carbohydrate. So here carbohydrate is grains, fruit, vegetable, and sugar and yeast are being used. So alcohol also considered as a psychoactive drug. So what is psychoactive drug? Psychoactive drug, something which has effect on our brain. So it depresses our central nervous system, and it has the adverse effect of our sleep pattern, of our thought, of our awareness, everything. So you can see when a person taking alcohol, the person may talk something not relevant to um, from not relevant. So it can this is for the psychoactive drug consumption. So types of alcohol. So classification of alcoholic beverage, here is the method of how is classified based on their method of the preparation. So alcoholic beverage classified in a three major like fermented, brewed and fermented, and distilled. So in fermented, wines, cider and perry are coming. In the brewed and fermented, beer and shake are coming. And in distilled, we can see spirit like whiskey, liqueurs, and the fruit brandies are coming. Exactly. So here, what is in alcohol? Alcohol mainly formed from ethanol, which is ethyl alcohol, flavoring agent, mineral, and water. So different beers have different alcohol contents. We all know that malt liquor has higher alcohol content than most other brewed beverages. It is important to remember that not all drinks are created equal amount of alcohol. So from this picture, we can see that 44 ml of uh, mixed drink contain 80 proof liquid. So proof is depend as a how much means if we can consider 100 ml of alcohol means 50% of ethanol is present. That volume means whatever the volume jo hai usme 50% ethanol is present. Maybe the the glass is contain 100 ml of alcohol, but the ethanol present is 50%. This is called proof. So you can see 44 ml is containing 80 proof liquid is equal to 140 ml of wine is containing 80 proof of 80 proof, and 355 ml beer or wine cooler is containing same that 80 proof of liquid. So it's not same for the all kind of alcohol beverages. So from here, Ranjita will continue, and I will Ranjita, over to you.
Thank you, Sushma. How you explain the whole thing from the statistical data till the different types of alcohol definition.
Sorry to interrupt, Ranjita. Your video is not on yet. Yes.
Am I both audible and visible now?
Yes.
Okay. Thank you, Sushma, for your clear explanation about the statistical data and the various types of alcohol and the alcohol definition. So here comes another most interesting topic, that is binge drinking. So we all generally have somewhere or somehow we all have to come to know about the term binge drinking. What it actually means. So binge drinking means that consuming excessive amount of alcohol within a short period of time. This is the simple definition, or if you have to understand in simple what this is a simple definition of binge drinking. But according to the National Institute on Alcohol Abuse and Alcoholism, it defines that binge drinking as a pattern of drinking that brings blood alcohol concentration, that is BAC, to 0.08% of alcohol per deciliter or higher. It
I
simply
think
defines.
you can switch off your video. Just little bit technical glitch is there. Later on, you can switch on during the discussion Q&A.
Okay. So it actually depends that when a particular person is consuming alcohol, so the amount of alcohol present in their blood determines the blood alcohol level. Next slide, please.
Ranjita, you please be bit slow. You are running a little bit fast. We have time, so you can explain everything.
Okay. So this is another topic that what actually determines that how drunk you are. So by commonly seeing the everyday scenario, we have came to know that when a person is having slurred speech or he or she is heavily sweating, by seeing this physical signs and symptoms, we can understand no that person is drunk. Right now, he or she is drunk. But what actually determines that he or she is drunk is the blood alcohol concentration. It can also be defined as blood alcohol level, which is BAL. So it is the same thing that I discussed earlier, that what actually says BAL, that the amount of alcohol present in blood after consuming alcohol or any alcohol related beverages. Next slide, please. Yeah. So, as the blood, it is also has the another name, that is blood alcohol content. It is the definition of the measure of amount of alcohol a person has in their blood that develops from consuming alcohol or alcohol-related beverages. That's the same definition we are getting from the beginning. So moving on to the next slide. Yes. Here comes one of the most variant factors, that there are very few factors that affect the blood alcohol level. Not by saying that no, there is a two or three factors. No, that age, gender, sex. No, it's not so. There are many more factors that which we obviously unsee, which we don't even try to remember or which we every ignore. That is the age, tolerance level, gender, alcohol concentration, body type, and food. I would like to explain the food because it somehow affect the everyday scenario. So when a person is consuming alcohol without consuming with any other type of food or any other type of side dish, so the blood alcohol level, it tends to be higher than the person who is consuming alcohol with food. Because the alcohol drink which gets metabolized will have to directly gets metabolized by the liver. There is no such barrier because food is acting like a barrier. It will not affect the body in so detrimental way. But when we are taking the alcohol directly without having with any kind of food, it will obviously show some detrimental effect on our body. Next slide, please. This is the mathematical calculation of blood alcohol level. So the formula of BAL or blood alcohol level is 150 divided by body weight multiplied by percentage of alcohol divided by 50 multiplied by ounces content multiplied by 0.025, which is the standard or constant here. For example, I have taken an example here that 175-pound man drinks 12 ounce cans of beer with 4% alcohol content. So when we're going to calculate the BL, we have to simply put the values in the formula and the rest we have to calculate with it. But here comes one of the most common questions, that is, every time we calculate the weight in kg, so we are not accustomed how to calculate the weight in pound, or we are not so known about this. So here comes one of the solution or one of the trick to it, that is 1 pound is equals to 0.454 kg. So by this calculation, we can easily calculate the given value in kg and solve the rest of the condition. And I would also like to focus on the last one, that is where is written 0.08%. It stands for euphoria. It is the range chart and it is the character of that particular range. We will come to this part later. Next slide, please. Sorry. Here comes this one that I'm talking about, that the range chart according to their character and description. As I have written the 0.08%, so it comes under the range of 0.03 to 0.12, which is the euphoria stage. Yes, there are various ranges that describe the various character, and according to there are some various symptoms. For euphoria, there is poor judgment, fine motor skills, impaired or short attention spans. For like 0.3 to 5, is the coma stage. Here the body temperature decreases, heart rate decreases, even the person could die. So there are the various characters, and according to this, these are the various description of physical signs and symptoms which we generalize see, but sometimes we have to pay more attention or pay more clear vision about the gastric health, which determines the various ranges. Next slide, please. Yes, this is the data that is for men. How much drink is equals to for weight in pounds, and for what value is getting is to categorize the influence possibly impaired or legally intoxicated. When the value is getting more and more higher, that is 0.16, so it gets more high, the more the person is legally intoxicated. Same as the formula 1 pound equals to 0.45 kg, and this is shown in men. Next slide. The same formula is applied for in case of women by multiplying the 1 pound equals to 0.454 kg. We can also get the body weight in pounds for women and calculate the drinks she is consuming to the calculating data that she is legally intoxicated or impaired or positive. Next part will be discussed by one of my co-speaker, Fatma Fidros. Over to you, Fatma.
Yeah, video is not yet playing. You can play the video.
So, good evening, everyone. Thank you, sir, for giving this opportunity. First, I would like to draw your attention just by playing a short video.
After alcohol leaves the mouth, it flows down the esophagus and into the stomach. If there is no solid food in the stomach, most of the alcohol moves down into the small intestine and will come in contact with the intestinal wall more easily and pass quickly into the blood. In this way, all the alcohol of one drink may be absorbed within 30 minutes. If one drinks alcohol with food in the stomach, it will be trapped with the food in the stomach, where absorption is not very efficient. It can't move into the small intestine immediately. This slows the absorption of alcohol into the bloodstream considerably, and the person will become impaired more slowly and will reach a lower peak alcohol concentration. Also, alcohol increases acid in the stomach, which, in alcohol abusers, can lead to a severe stomach pain or sores in the intestines. This is why it is a good idea to eat a nice big meal while you are drinking. In fact, the presence of fatty meals can significantly reduce the peak blood alcohol concentration, BAC, up to 50% relative to that produced when alcohol is consumed on an empty stomach.
Okay, so I would like to summarize this video. Like we all know, digestion of alcohol is not like the other food. Once alcohol is swallowed, a small amount is absorbed directly by the mouth and mucosal lining of the mouth. Okay, so we know that when a person drinks alcohol, feel thirsty afterwards. Why does it happen? Because alcohol dries the mouth and can even dehydrate the entire body. Because alcohol have a drying effects which results in a white tongue, because it occurs when papillae become inflamed and bacteria and dead cells become trapped within them, causing a white film to cover the surface of the tongue. After alcohol leaves the mouth, it flows down to the esophagus and then to the stomach. So there are two scenarios. So one is there is no solid food present in stomach, and the other one is when there is some foods present in stomach. So when there is no solid food present in stomach, alcohol moves down into the small intestine and will come in contact with the intestinal walls, move easily and pass quickly into the blood. By this, it absorbed within 30 minutes, just one alcohol drink. But in the other case, when there is food present in the stomach, it will be trapped with the food in the stomach, where absorption is not very efficient. It can't move into the small intestine immediately. This will lead to the slows the absorption of alcohol. And we have seen earlier that alcohol increases acid in the stomach, and which cause alcohol abusers can lead to severe stomach pain and sores in the intestine.
We often see the people who drink alcohol, more alcohol, like high amount consumption of alcohol, suffers from stomach pain or intestinal disorder, right? We have seen this kind of situation. So this is the reason, because alcohol increases acid in the stomach. So that's why it's suggested, if a person, your patient, we see are so keen to drink alcohol, we can suggest that eat a nice big meal while you're drinking. Why is it so? Because it reduces the peak blood alcohol concentration, as we have seen earlier, comparison to empty stomach. So majority of absorption takes place in the small intestine. Why it's happened? Can anyone say? What type of cell present in small intestine? Anyone? Okay, so there are epithelial cells present in small intestine, and the epithelial cells have a finger-like structure. As it increases the surface area, it increases the absorption of nutrients and other molecules through the membrane. So alcohol moves across the epithelial cells through the intestinal space and across the epithelial cells. So their capillaries are also present, which are made of endothelial cells, and the biological membrane structure allows small uncharged molecules like ethanol, carbon dioxide, and water to pass directly through the membrane by the process of diffusion. And from there, it goes carried by the bloodstream into the vein, and it distributed throughout the cells of different organs like liver, brain, kidney, lungs, skin, and even the unborn baby. So we will see that in the brain, when alcohol directly affects the neurotransmitters which control behavior and thought. It blocks chemical signals between brain cells called neurons. Okay, so we can see if a person drink alcohol in a small amount, we can see the immediate symptoms of intoxication, like their mood change, their poor memory, slow reflexes, their discoordinated movements, like this, right? So the effects are directly related to the amount of alcohol consumed. जितना वो alcohol person alcohol consume करेंगे, the more we see the effects or intoxication in their expressions. Like, okay, so however, like many drugs, alcohol also stimulates the release of dopamine. So dopamine is like a happy hormone, right, in our body, which tricks our body into feeling pleasure, and in turn make the person associate drinking alcohol with feeling great. So the tricky part here is that the more the person will drink alcohol and get that feeling, our body will release less dopamine. Okay, you understanding? If the person is drinking alcohol to get that feeling, but in turn, what is happening in our body? That dopamine will release less amount. Okay, so over time, the person will end up mentally hooked forever in search of that pleasurable feeling, and the person will think that alcohol gives that feeling, and there the addiction takes over. We all know that the organ that process alcohol is liver, and liver is the largest organ in our body. What is the main function of our liver is to get rid of poisons like alcohol that enter the body. So like around 90% of ingested alcohol is metabolized by the liver only at a rate of approx half an ounce per hour. 1 ounce approx 30 ml. So half an ounce like around 50 ml will metabolize by a liver in 1 hour. So you can see the rate of metabolism of liver, just 15 ml will metabolize by liver in 1 hour, taking 1 hour. It also varies from person to person. Okay, so the rate of degradation and clearance in the liver depends on a variety of genetic and environmental factors, including our body size, all this. I would like to mention that in our liver, there are two enzymes present. That is alcohol dehydrogenase, ADH, and aldehyde dehydrogenase, ALDH. What this enzyme do is, these enzymes helps to break apart the alcohol molecule, making it possible to eliminate it from the body, or in turns, it creates a substance that are even more harmful than alcohol. So heavy drinker over a period of year can damage the liver cells and cause liver diseases. Okay, so we can see the highest consumption of alcohol, though who drinks more may end up over a year having liver disease, severe liver disease because of this. Another thing I want to mention is male and female differ in their ability to metabolize alcohol. Why? Why does it so? Because the amount and activity of ADH present both of them. Males have a highly active form of ADH in their stomach and their liver. The presence of ADH in the stomach of male can reduce the stomach of alcohol by 30%. But on the other hand, women produce smaller quantities of ADH enzyme or have almost no ADH in their liver and stomach. In result, what happened? Female absorb more alcohol into their bloodstream. Additionally, the ADH in the liver of females is much less active than the ADH in the male liver. So we can see that the both consume the same amount of alcohol, but the female will get more become intoxicated within short period of time. So this is the slide of summarize of the video. Now this slide is shown like alcohol of metabolism. Like if person drink one alcohol, so within 30 seconds of consumption, alcohol enters the bloodstream and travels to the brain. But after 5 minutes of consumption, it enters the stomach where a small amount remains and expelled through breathing and sweating. So a person just have consumed alcohol. Within 5 minutes, we can feel that the person have drunk alcohol because of their breathing and sweating. Next 20 minutes after consumption, 90% will have reached the small intestine, pancreas, and liver to get metabolized. But up to 12 hours after consumption, in this time window, it can be detected in their urine and many standard tests of the consumption of alcohol. Here is a small flow chart. We can see here the mean, as I mentioned earlier, two enzymes, that is alcohol dehydrogenase and aldehyde dehydrogenase. How it helps to metabolize alcohol in our liver. Now comes the most important and interesting slides for us, like dietitians. Like many cases we have seen where patients come that they drink alcohol, whether they are low income group or high income group, right? So we need to know how, in which category of alcohol contains how much calories. Suppose a person drink light beer, quantity around maybe 300, 350. So it gives how much calorie? 100 kilocalorie. But on the other hand, if a person drinking strong beer, same amount, but the calorie increases up to 180 kilocalorie, then more 80 kilocalorie than light beer, right? Then breezer 360 ml gives 220 kilocalorie. Same like whiskey, gin, brandy, rum, vodka, same amount giving same kilocalorie. So if a person patient saying I'm drinking brandy or vodka, 30 ml. They say in their language, one peg is equivalent to 30 ml. So we can assume that they are intaking 66 kilocalorie in one peg. If a person is saying 5 peg they are taking. So just we have to calculate this 66 into 5 and we will get the kilocalorie they are consuming by drinking, right? Then red wine, 100 ml gives 70 kilocalorie. On the other hand, Scotch, same amount, 100 ml, but giving the most kilocalorie, that is 235. So for daily day-to-day practice, we need to know about this kilocalories present in different types of alcoholic beverages. Here, another interesting slides. I would like to draw your attention here. If a person or patient saying, I have cut down the white bread, I have not taken pizza anymore, I have not taken chips anymore. But on the other hand, they are taking beer, instead they are taking white wine. The person is taking mojito or margarita. So we need to understand them. If you are cutting down the piece of bread, but you are consuming the white wine, both are equivalent in calories, isn't it? So this is the thing here. Here is the factors where leads to alcohol consumption. Like we see nowadays what happens if there is a celebration or any occasion in the mind of youths, what comes first? how to celebrate their enjoyment, their happiness. Can anyone say? Like drinks. They just go and buy drinks or just start their celebration with beer or champagne or wine, right? So there is a drinking culture. It become a drinking culture, which leads to alcohol consumption. The gender, age, even the poverty marginalization. We can see in the lockdown time, if anyone remember that everything was closed, but alcohol is still open, right? Anyone remember? As far as I know, yeah, there is some shops. So, so there are some poverty marginalization is also there, which leads to alcohol consumption. They don't have money for healthy food, medicine, but they must have medicine for alcohol. So this is the population group also leads to alcohol consumption, and which leads to incidents and disability, chronic diseases. We have seen earlier in the statistical data that teens who are drinking alcohol are lead to many incidents, deaths, accidents, which leads to increased mortality rate. Now I'd like to hand over the platform to Ranjeeta. She will continue the presentation by explaining effects of alcohol consumption. Thank you.
Really very nicely explained by you, and very important things are being explained. Moumita, please carry on. We will take the discussion at the end.
Ranjeeta.
Oh, this part will be covered by Ranjita. Okay.
Yeah.
Thank you, Fatma, for the clear explanation about the metabolism and the various factors. So now it is the most important and significant topic of alcohol, that is the effects. So if I think that what are the effects of alcohol, we can generalizingly say that there are some few diseases or some few major diseases that can be caused by the excessive consumption of alcohol. For example, I'm taking an example that when you saw a person that he or she is regularly drinking or he or she is drunkard, you can say that he might be suffering from cirrhosis of liver. It is one of the most prominent diseases that a patient suffers when he or she consumes excessive amount of alcohol. But beyond this, the effects are categorized into two sections, that is the short-term effects and the long-term effects. I would like to focus on both these terms specifically, on both these effects specifically. Next slide, please. This is the pictorial of overall effects that can affect our body, from memory loss to high blood pressure, erectile dysfunction, infertility, miscarriage, liver damage, lung infection. These are the common or generalized effects that we saw. Next slide, please. Damages. There are various damages in which these are the most common and most prominent ones. So nervous damage, liver damage, as we talked about, the cirrhosis of liver, one of the most common causes. Stomach ulcer, skin, heart damage, sexual, there is the infertility, and erectile dysfunction disorder.
Sorry for the interruption, Ranjita. Try to say a bit slow as your voice is already cracking. So little bit slow. थोड़ा ब्रेक करके बोलो, थोड़ा ब्रेक करके धीरे धीरे बोलो.
Okay. Can I go back to the previous slide?
No, यहाँ से आप बोल सकते. हाँ बोलिए बोलिए बोलिए.
Okay. So this is the short-term effects. So what do you understand by the term short-term effects? After consuming alcohol, within the 2 to 3 hours, the effect starts to show, or the symptoms started to show that the body has consumed alcohol. So what are the symptoms? That impaired judgment, vision, problem in hearing, difficulty in breathing, headaches, vomiting, tiredness, slurred speech, difficulty in walking. These are the short-term effects which we generally see in our trailer. This is a short description of the various short-term effects, from heavy sweating, lowered reasoning ability, lowered inhibition, mental confusion, memory loss, coma, anxiety. These are the short-term effects of having alcohol. Coming to the next slide, that is the long-term effects of drinking. So the person might be taking alcohol for long days or for years to years or for months to months, and he's continuing without any break. He's just having alcohol. Just like I'm taking an example of it, that a person, and he's a diabetic patient, so he continues to drink alcohol every day. This is his everyday routine. So he might not be known about what is gonna be the long-term effect. It might tend to most of the problems, that is from liver, severe swelling, pain, hepatitis, cirrhosis, which I've already talked, or your liver cancer, muscles weakness, loss of muscle.
Ranjita, Fatma, can you continue this portion? Unfortunately, people are unable to listen. This portion is so important, but we cannot hear Ranjita. So, just overview, Fatma, if you can continue, and Ranjita, if you can rejoin by that time. Because
Yeah. Sure.
people are writing in the chat box, even I cannot hear you. So interesting, and the presentation is made also very beautifully. Just you can, I
Yes,
know you are not prepared with the particular slide, but you can just give the glimpse pictorial. It's okay.
Sure, sir. So as we have learned earlier also in metabolism part and in description also, the long-term effects of drinking. It affects in various part of body and various organs it affects. So we need to know about all this so we can explain our patients thoroughly. So how it affecting our body. By in nervous system, tingling and loss of sensation in hands and fat. Heart, it can lead to high blood pressure, irregular pulse, enlarged heart. It may lead to sexual organs disorder also, like impotence, damaged legs or sperm. In female as well, there is risk of in the risk of disorders like damage to fetus if pregnant also, and greater risk of gynecological problem. In brain, it may lead to brain injury, loss of memory, hallucinations. And I said earlier also that liver, it leads to a severe liver damage, hepatitis, cirrhosis, and liver cancer. How it's affecting our brain. Just we have taken just small part at how it's affecting brain. As I said earlier also, it attacking our central nervous system. So the cerebral cortex, where the emotions and control are controlled, it's affected senses, hippocampus, like blackouts, impaired memory, reduced perception of to learn new information. Hypothalamus, it reduces our heart rate, slowed heart rate. Okay, so just here also a short video. I would like to.
Alcohol is a depressant that affects both inhibitory and excitatory neurotransmitters such as glutamate and GABA, which is why you feel less inhibited and less coordinated after a few drinks. Alcohol's effects on the brain may also cause slurred speech, poor judgment, confusion, slowed reaction times, worsened motor performance, and blurry vision. Teenagers who drink are even more susceptible to alcohol's negative effects because their brains are still developing. Two parts of the brain that are particularly affected by alcohol during the teenage years are the hippocampus and the prefrontal lobe. The hippocampus plays a pivotal role in learning and memory formation. Studies of adolescents show that heavy and extended alcohol use is associated with a 10% reduction in the size of the hippocampus. It also shows that the function of the hippocampus is uniquely sensitive to alcohol at this age, and that alcohol may be poisonous to its nerve cells, damaging or destroying them. As a result, teenagers who regularly drink have difficulty creating new, lasting memories or recalling information. The prefrontal lobe is important for planning, judgment, decision-making, impulse control, and language. This area of the brain continues to change during the teenage years and into the early 20s. Research with heavy drinking adolescents show that these young people have smaller prefrontal lobes than young people of the same age who do not drink. While research tells us alcohol can damage the developing brain, it is not clear how much alcohol it takes to do this. So avoiding alcohol during the teenage years is certainly the safest choice. If you or a loved one is suffering from alcohol addiction or abuse, call our helpline.
Okay. So here we learn that the most alarming age group is teenage group, isn't it? So for the next future generation, we have to say this, we have to control this, because it may lead to hazardous effect. Okay. So here we just see slide right with how it's affecting our sleep. That low amounts of alcohol decrease sleep quality by 9.3%. Okay, so if a person drinking just 2 glass, a moderate amount of alcohol, it will increase 24%, and a high consumption will lead to 39.2%. So as it affects our organs, our brain, so ultimately our sleep will also affected by the consumption of alcohol. Now, I would like to hand over the presentation to Moumita sir.
I would like to thank my teammates and SAD also for giving me these opportunities. Many people want to know that it is okay to drink alcohol during pregnancy. No, it is not okay to drink alcohol during pregnancy. Even small amount of alcohol can be harmful, and there is a no safe level or the safe time to consume alcohol during pregnancy. The consumption of the alcohol during pregnancy poses a significant risk to the developing fetus and can lead to a range of the adverse effect to the fetus. Okay, next slide, please. Here are some risk factors of alcohol, like the low birth weight, the preterm delivery, the birth defects, and the fetal alcohol spectrum disorder, and the developmental delay and the long-term cognitive disabilities. Next slide. Why alcohol is not recommended? When a pregnant mother drinks alcohol, it crosses the placenta and enters the bloodstream of the fetus. The developing fetus lacks the ability to process and metabolize the alcohol as efficiently as adults, which can result in the serious and permanent harm. Okay, and what is the alcohol syndrome? The alcohol syndrome is a condition that develops in fetus when a pregnant person drinks alcohol during pregnancy. It is a more severe form of the FASD. FASD means the fetal alcohol spectrum disorder, and can lead to the physical, behavioral, and the cognitive abnormalities in children. Next slide. We can see here there's some abnormalities like the small head and the small eye opening, the low nasal bridge and flat mid face and the thin upper lips, etc. Next slide, please. Children with the fetal alcohol syndrome may have the cognitive and behavioral impairment, including the difficulties with the attention, memory, impulse control, and learning. And the other disabilities are the developmental delay, like the problem solving and reasoning issues and hyperactivity, and in the behavioral social difficulties, like the poor social interactions, the problem in school, and the difficulty adapting to change, the poor concept of time, etc. And the other risk factors are the alcohol consumption during the pregnancy increases the risk of miscarriage or the stillbirth, and also the preterm birth weight and the long-term consequences for the children. To protect the health and well-being of both the mother and the unborn baby, it is strongly recommended to abstain from the alcohol completely throughout the pregnancy. Next. Here is a poster. Next slide, please. There are some counseling tips for follow the advice to drink safely. Understand both how much alcohol you are having and how much you should have. The next one is eat before and drinking session, and count your drinks, slow your intake with the alcohol filled free drinks and skip the drinking game and shots. Don't drink and drive. Just say no if you are not willing and pregnant or the lactating human. Here are some also the tips for the dietitian or the nutritionist. That instead of the telling our patients to cut down completely, we counsel the patient to cut down gradually. It is more helpful for the patients. As per the ADA, the 2 drinks for male and 1 drinks for female per day permitted. But still, who want to drink, who don't drink, as a dietitian or the nutritionist, we should never encourage to drink through wine having the health benefits. Thank you all so much for taking the time out of your busy schedule to be here tonight. We hope that we inform you something new and help you in your future for better patient counseling.
Thank you all the speakers, and thank you all the audience for patiently hearing about the facts and about the alcohol. So we can get all the speakers, if you can, if it is possible to switch on the camera. For all the speakers, we can stop sharing the screen. We can start a question which is already put into the chat box by Shumona. So as a person, if a person takes alcohol, which variety is good and at what quantity? So Fatma, do you like to answer anything? Then I can put some point with you.
Yes, I sure. So there is no specific brand or company is good for alcohol. As we have seen throughout our presentation, that alcohol consumption is not good. Okay, if a person is drinking, yeah, we can, as a dietitian, we can say that red wine is, we have seen some health benefits in them. So we can recommend that you can drink with a limited amount and frequency as well. So we have to check that how much they are drinking, how frequency they are taking in a week or in a month. So we have to see that. There is no specific brand or company for drinking alcohol.
So if someone says that red wine is having very less calorie, it is having high amount of antioxidant, it lowers the bad cholesterol, it is good for heart, it regulates blood sugar, it even reduces the risk of cancer because of its antioxidant property, it is good for cold weather and treat cold and cough, and even it is good for memory and it helps in weight reduction. If we listen this much of health benefits, so should we recommend that if to a non-drinker to drink red wine?
Still no.
Still no. The perspective is very correct. So as a dietitian, we should not promote alcohol because there is some percentage, as we see, even breezer is having very less percentage of alcohol, as I know, but it is having very high calories. So now moving to another question, that if a person, Sushama, if you can answer, if a person is already diabetic and the person is already taking insulin at bedtime, the person have experienced even hypoglycemia at midnight. So person has a tendency to take alcohol in the weekends. So what should be the guideline?
So first of all, you should not encourage him to take alcohol. Firstly, we have to discourage him to take. But if he insists so much and it is his habit or her habit, so we can suggest, firstly, we can suggest him to talk to your doctor first. Then from our side, from our dietitian side, we can tell that you can take high fiber food with your as companion with your alcohol, like something with nuts, something
Or
almonds,
sprouts or nuts or
cashew,
those
sprouts,
which
nuts,
having the very low glycemic index,
low glycemic
and which will slow down the
the
absorption of
absorption of alcohol.
alcohol, can
Huh.
be within a permitted limit.
Within permitted limit, and we can also suggest high protein like paneer tikka, chicken tikka, means kebab, which is not too much oily. Also, we can
Well,
suggest. restricted.
Oil should be restricted.
Oil
but
should be, and acid also should be restricted, because acid and alcohol is an adverse effect for our body. So we should
Yes.
suggest it like that. But we firstly have to discourage him to take. This is our first motive.
Because when a person is coming to our clinic, and Moumita, when the person sometimes come to our clinic, so the person first thing they used to ask that how much we can consume. So, Moumita, if the person is consuming once in a month, but it is too much of consumption, so what will be your recommendation? He or she can tell that, Madam, I am not taking regularly. आप तो बोले American Diabetes Association's guideline is one drink for female. So वही मेरे पास ये क्वेश्चन आया था from a pharma patient, from a pharma background manager. So, Shomendu, you are telling from one drink or two drink every day. So, उसको jot down करके सारा monthly ले सकते हैं कि नहीं, और टूल हो सकते हैं कि नहीं. तो आपका क्या हो जाए, आपका recommendation क्या होगा for a middle aged person, even with cholesterol is high, and थोड़ा बहुत तो सब कुछ lifestyle problem तो रहता है, hypertension and all this.
No, it is completely not recommended to take all of those things in a day, a particular day. If it is completely avoided, it is good. But ज्यादा लेंगे तो उसका इफेक्ट तो पड़ेगा ना. एक एक करके लेंगे तो ठीक है.
Obviously, for the single day also, person can experience even to death also. So that is can be very fatal. And if the person is diabetic and person is taking 5 peg or 10 peg, so it can be very much fatal to the patient. First of all, we have to take one question. Anindita ma'am has raised her hand. She is there. Thank you, ma'am, for joining with us. Ma'am, what will be your question?
Can you hear me?
Yes.
I just want to know from your team, and for the students and for you, anybody, wanted to know about the diabetic patients. What type of drink is better, wine or whiskey? Number one. And second is that I wanted to ask Fatima, what is your opinion about the asthmatic patients for the alcohol consumptions? If the beer or something.
First, I need to know from you how you like the session. How is the session?
Yeah, it is pretty good, but the audio sound, some problems are there, and otherwise nice presentations they made, and they really made their nice presentations, and hope to see more this kind of sessions in
Thank
future.
you.
And all are very nice. Keep it up, dear all. My heartiest congratulations to all of you.
Fatma will answer, but I also request you to add some point. Fatma, you can give a try for asthmatic patient, and then ma'am can add some point, because
Yeah,
ma'am is a full-time practitioner and she has lots of experience in counseling patients taking alcohol.
And one more question, Shomendu. I just wanted to add, whenever we are getting the infertility patient, infertility patient nowadays, for the PCOS, for the thyroid, for the bad lifestyle, the previous rather than the previous, whenever we started doing the dietitian's course and all, we didn't get so many gynae patients, the PCOS patient, infertility patients that time. Nowadays is increasing the amounts of the patient, right? So it's the bad lifestyles, it affects the fertility. So what type of how many days before they can stop taking that alcohol? Many people are saying that, ma'am, we are in IT professions, we have to take within in a 1 or 2 drinks fortnight or things. So how many months before? 2.5 months? And what you suggest? So
those who want to conceive?
Yes, that's the reasons for you. That's the questions for you.
Even I need to say to the audience that is the patients who are planning to conceive.
Yeah.
Even for the male partner also, it is very important.
Definitely.
That is to stop alcohol at least 3 months before, or if they are planning pregnancy for the female partner, obviously it is no to the alcohol.
Absolutely.
We have discussed, by Moumita has discussed, that during pregnancy it is big no. But yes, if the woman is planning for pregnancy and already the woman is having too much of problem, as ma'am said. So
Yeah.
PCOS and all this. So
Yeah.
in this case, we should not give any relaxation to the patient. So it
Hmm.
is no for you.
I
So
just wanted to add the presentations with you that you can some suggest the spermatogenesis and the ovulations. It impacts a lot, right? So you can add on these presentations also.
okay, okay. Next time we will, if we keep, we will obviously thank you for
Uh,
suggestions. And
Otherwise, it's so nice, very nice. I like it very
obviously,
much.
yes, and obviously for the asthmatic attack, as per my knowledge, yes, it aggravates the problem for the asthmatic patients, and it is also depend on the patient to patient severity of the patients, because the all patients are not same for us. But again, it is not at all advisable for the asthmatic patient who have the asthmatic attack, especially, and the
Yeah.
asthmatic attack comes at night, especially, and
Yeah.
these are very much bad. And even I have seen it, I don't know we should call it an allergy or not, but
Hmm.
yes, there is a big problem with that asthmatic patients.
Yeah. And for the
Uh,
diabetic, what do you suggest? The
because the
wine, red
histamine,
wine, or
because
whiskey?
histamine is produced from the bacteria and yeast when the alcohol is fermented, and this
Yes.
basically are very much allergic for the patients who are specially asthmatic. Uh,
Absolutely.
and for the diabetes patient, I want to know from the speakers, because diabetes is a very common problem nowadays in India, and patient will obviously take alcohol. So, what will be your suggestion, Ranjita? Ranjita, are you there?
Yeah.
Yes, I
Yes.
ma'am, if she kindly says the question once more.
Diabetes patient, what will be your recommendation? How much and what type of drink should be your recommendation?
Well, there is no such type of drinks that we can recommend to a diabetic patient or any kind of patient. But as there are various types of drinks, in between them, red wine has many more benefits compared to the other drinks. So, keep in mind the other physical conditions or the medical examinations of that particular diabetic patient. We may or may not recommend the red wine, but we cannot recommend the patient obviously to have this kind of drink or to have another kind of drink.
No,
But
that is again your voice is breaking. To add on this point, that diabetic patient may not take red wine, and red wine doesn't taste good. So patient will not, because patient, what Fatma has nicely explained, that patient थोड़ा नशा के लिए लेते हैं, and what is that nasha? So what is that? That is why the patient enjoys. So that's why more often the patient will either take this rum, or they will take beer. So beer will be malt based, it will be wheat based. So I do not recommend my patients to consume beer who is having high blood sugar level. If the blood sugar is under control, the patient is using SMBG, self monitoring blood glucose, we can permit to the drink, because as Fatma has showed a very nice slide, that beer people used to take in a bottle like 365 or whatever is big bottle, they will not consume in one or two pegs. And for that, what madam has asked, that for these other categories, those Fatma, you have showed that 30 ml of wine, that can be taken one or two drink with the high fiber snacks, or the choice should be high protein snacks, but not more than two drink, even if the person is consuming for one day. Even some patient has come to me and said that I am, my sugar level is controlled, एक ही दिन लेते 3-4 pegs लेते, so I do not recommend. That will be my say. And Meera ma'am has given a very good question. Meera ma'am, if you can unmute. Meera ma'am is from Tamil Nadu, Chennai. I have seen many people are taking Dr. Brandy's during the winter season. Is it advisable? And how much is the permissible limit? Dr. Brandy's is recommended by the doctors even, and the patients who are very much weak, patients even after delivery, even given to, I have seen by some doctors, the patients are very much weak, or in the very cold weather, because Dr. Brandy बहुत ही heat कर देता है bodies को. So that will be, ma'am, I think it will be in limitation. As per my knowledge, it should be like same as the other wines. It should not be too much. Even Dr. Brandy's are recommended in 15 ml, that is 3 teaspoon or 15 ml with milk even suggested for the improvement of health. So that is Dr. Brandy's is totally a different perspective in the variety of oil. And if you want to add anything, ma'am, you can add to this point.
Oh, okay, sir. Thank you. Thank you. Nothing else. Thank you. It's
Okay.
very good presentation. Very nicely presented.
So,
All
ma'am,
the
it is a
speakers
pleasure
very
that
well.
you have joined. It is a great pleasure that you have joined, and it's nice. Actually, ma'am's is from South India, but ma'am's belonging is Kolkata. Ma'am's has completed in hygiene only. So that is deep diet, I think, na, with Shudeshna ma'am's
Yes,
batch.
yes, yes.
Yes, yes. So,
Thank you.
nice. Thank you. And if you want to add anything, Mira ma'am, you can add.
No, nothing else. Thank you.
Okay, okay. Jyoti, do you have question? Jyoti ma'am is done. Jyoti Patisha, I have asked once upon the time. Jyoti, if you want to add anything, brandy or treating fever. Okay. Yeah, Jyoti, you can add your values, please.
Yeah, good evening to everyone. Speakers, congratulations, wonderful job. Sir, I have one a question. I think if everyone can answer this, if any one of you can answer this, we have seen this that not just in cold weather, even during fever also, we have seen this tradition of giving this brandy or the rum, even rum also during fever or feverish conditions also. My point is, what should be the limit? Number one. Number two, is it really helpful? And if it is helping, that how it is the what is the logic behind it? If anyone can answer, will be very helpful for this.
Okay, I would like to take the question. So
Thank you.
in fever, they are taking rum.
Yes,
As,
yes.
per-
Please take
as
the question. Sorry, I got a call. Yes, Fatma, you continue. I will add some point.
yeah, so
Mhm.
sure. So as per my knowledge, as I said earlier, also in metabolism part, that consuming alcohol will dehydrate our body, and in a fever condition, our body is already very weak, very low immunity, and
Mm-hmm.
also so the also we feel body dehydrating fever some cases. So I would like not suggest to take rum is a good option as a medicine also to treat fever or in
Even
case fever.
just I want to add, even if anything Jyoti ma'am wants to add, you can also add. If the patient is non-alcoholic, so we should not totally, we have many other options to treat
Yes,
cold and cough. But if the patient is already have some, that patient used to keep in their fridge brandy or rum, and they usually is drinker, so actually it is having an antimicrobial property. Both this rum and brandy having antimicrobial properties, so they are very much sometimes soothing if it is taken in very less quantity, like 15 to within 30 mls, so it can help. But it is also, I think it is also having anti-inflammatory properties, which even शोर थ्रोट होता है, बॉडी एक होता है, म्यूकस आ जाता है, so it क्या होता है ना, it also helps to reduce these symptoms. Even I think as you are asking, brandy will be more better than rum because of its antimicrobial properties for throat infection, cold and cough. So it is, and it also for a long run it boosts the immunity as it, if it is taken in a medicinal dose. But we should not recommend to someone who is not taking brandy, rum, or any drinks, or they do not have any like like tendency to take this.
Absolutely, sir. Even for the occasional, the ones who takes drinking occasionally also, we need to stop that because कोई that occasion कब वो regular बन जाए and that becomes a habit, no, that we need to try to limit their consumption from then and there only. As you as speakers was saying during the presentation कि एक नशा हो जाता है या फिर ओकेशन ही तो है, क्या है, चलता है, बट वो चलता है कब वो रेगुलर हो जाए, that becomes a mistake for our life also, and that can be health threatening as well as.
And even I think this rum is do not have any scientific evidence to treat this kind of problem. Yes, घरेलू टोटका हम जो बोलते हैं या टिप्स, हाँ, तो वो थोड़ा बहुत वी कैन ट्राई, बट ऐसा कुछ लॉन्ग टर्म एविडेंस नहीं है. सो ये एक बहुत अच्छा क्वेश्चन किया ज्योति मैम ने, बिकॉज दीज आर द कॉमन थिंग व्हेन यू विल कम टू प्रैक्टिस ना, when you will come to clinical practice, when the patient will come, so patient will teach you these things. So you should have a strong evidence to defend the patient that इसका क्या है नहीं है, नहीं तो patient आपको सिखा के निकल जाएगा. बिकॉज वो उन्होंने तो अल्कोहल के ऊपर पीएचडी कर लिया ना, बहुत उसको पसंद है. तो हम लोगों को उतना नहीं, हम लोग तो ये प्रेजेंटेशन के लिए ये बच्चे लोग पढ़ के प्रेजेंटेशन दे रहे हैं, मगर वो लोग तो इसमें एकदम माहिर है. सो दे विल गिव मेनी टिप्स coming to your chamber. So you should have some knowledge, because alcohol is a separate subject for the nutritionist. So when Ranjeeta chose this subject, I was very much fond that even I think I have suggested this subject. Ranjeeta has taken this call that we will do. So I think it is required.
Even sir, I would say one thing, that even I'm practicing apart from teaching in the colleges. What I experience from the patients, when patients talking, when counseling के लिए आ रहे हैं, or when they are asking for this thing, patient का gallbladder surgery हुआ है, and the very next day when the patient is getting discharged, they are asking, ma'am, can I start taking alcohol? जबकि उनका gallbladder already remove हो चुका है. This is so the ones who are specially, किसी को while समझाना is quite interesting, fine, ठीक है, but some are becoming adamant, और वो इतने adamant हो जाते हैं कि वो लेके ही छोड़ते हैं. So in that case we need to make sure कि हमें उनका जो limit है सबसे पहले एकदम cut down करना है, and gradually then we have to make sure that you should remove it from your life. This is very, very harmful.
Thank you for adding this point. Very, very well said. We have another question from Mr. Shomam Datto from ICMR NIN. Shomam, do you want to add any values or any tips for the patients or the patients who are on regular drunkard about the micronutrient deficiencies or anything? Do you want to add any point to this? And I cannot read properly the question. Shomam, are you there or you have left?
Yes, sir, I'm here. Okay. Actually, I don't have much experience with alcohol thing, but I just wanted to know, sometimes those who are like attending these corporate events or maybe some official events, sometimes it becomes necessary to take a few drinks. Otherwise, sometimes it becomes insulting for the host also. So these kind of situations keep coming.
Yeah. When I started, when I started, I just give this example only. So this is socialization. Sometimes became the colleague peer pressure, and peer pressure say nasha. So is conversion. And if some people can restrict themselves to socialization, it is okay. But in the parties, this is very rare. I have seen very rare that बहुत ज्यादा नशा करके उधर ही गिर गया, वॉमिटिंग कर रहा है, ये तो बहुत कम है. मगर स्टिल Shomam, I don't know. I have studied this very well it is my own observations to the counter that how they are doing. So even I find many hosts, those who have thrown the party, they are taking in more amount than the guests. So there's a courtesy, guests are coming, so guests are taking less amount and the host is taking more amount. But there is sometimes it crosses the limit. So depending on the patient's comorbidity or depending on the patient's age or the clinical parameter, or maybe some patient is having too much obesity and sleep apnea. So obviously you have to give some warning to the patients when they are getting socialized, because weekly once is very common in India in the urban populations, that weekly one drink, weekly one day. And in the office party, rightly said by Shomam, many of my clients or patients have said that monthly एक तो corporate parties होते ही है, तो वहां पे हम लोग को लेना ही पड़ता है. So ऐसा कुछ नहीं है, लेना ही पड़ता है. लेना आपने शुरू किया है, कम भी आप कर सकते हो, बंद भी आप कर सकते हो। तो ये मैसेज हमको पेशेंट को देना है। मगर ये शोमम, आई डू नॉट हैव टू मच ऑफ नॉलेज, इवन आई एम ट्राइंग टू just putting some interest into this, so that even when the patient used to see the calorie chart with us, with the dietitians, they are very, sir एक snap ले सकते हैं, एक फोटो ले सकते हैं, आप एक बार कैलोरी चार्ट दे दीजिए। ये बहुत इंटरेस्ट मैंने देखा है। सो पता नहीं कैलोरी लेके क्या करेगा, या अपना चॉइस बदलेगा या नहीं, आई डोंट नो, बट दे यूज्ड टू do that. Any more question in the chat box? Otherwise it is a good presentation and good audience also. Many of us has very eminent people have joined, so thank you all.
Sir,
Yes, Neha.
Sir, one of my colleague got an operation, like intestinal operation, few days back, and he is an alcohol addict. So just after his operation, he asked the dietitian if he can start drinking again, like the red wine only. So the dietitian denied completely, but upon his request, she said, okay, once in a week you can start taking only red wine, but only in small amounts. So is this okay? I mean, I'm unable to understand this.
Yes, it is okay. It can be given depending on the thing. दैट इज पोस्ट ओटी। आगे अगर बाईपास हुआ है तो मेरा रिकमेंडेशन तो नहीं रहेगा, या डॉक्टर भी नहीं बोलेगा जे जाके रेड वाइन शुरू कर दो। प्रिवेंशन के लिए कुछ लोग लेते हैं, नॉट फॉर पैशन, नॉट फॉर हेल्थ, कंसिडरिंग हेल्थ, रेड वाइन इज गुड इन लिमिटेशन, even prevention of cancer. Even there are studies you can see in PubMed, there are studies that prevent cancer, but obviously that during chemotherapy it is not advisable to take any even not even soft drinks also during chemotherapy, or when radiotherapy is going on, we should not go to this. Yeah, Ranjeeta, do you want to add anything?
Yes, sir.
Then I will take another question of Jyoti in the about the liver disease and something
Yes,
she has.
in the question Sneha has asked for this, I'd like to say that after having any kind of surgery, there should be at least 1 week gap before consuming any kind of drinks, whether it is soft drink or hard drink. So the person is alcoholic addict, still the doctor, the dietitian must counsel the patient not at least to have a break for 1 week before having or consuming alcohol drinks, because it is various research has been proved that after consuming alcohol quick after the surgery can show detrimental effects, can also back the healing process, can also cause it delay the healing process. So it's better to at least wait for 1 week or to have a break for 1 week, then the person can have alcohol but within the limitation.
Ma'am, how much we can, like if anyone insists a lot, then how much we can allow?
If, as I have already said that the person is alcohol addict, so we cannot recommend like this that the person should take this much amount of alcohol. For this, 1 ounce equals to 30 ml. So it's better to cut down into half. It's as the research has been shown, to just cut down to 30 ml to half. The better it will have, it will not provoke into addiction. So it's better. So it's better an option rather than to having addiction. It's better to cut down the alcohol. Not only partially can do so.
Yeah, Shomo.
Yeah, actually, sir, you were asking about this micronutrient deficiency thing. So regarding micronutrient deficiency, our diet is already deficient in so many micronutrients. So we cannot directly associate alcohol consumption with a particular kind of deficiency.
Even you can relate with especially vitamin D, depletion of calcium and vitamin
Yeah, but there are association. I mean, in epidemiological studies, it has been seen that there are association between alcohol consumption and deficiencies of different micronutrients. Basically, someone was saying that this alcohol, it irritates the lining of our GI tract. So definitely there are chances of damage and thereby less absorption and utilization, and it disrupts the entire metabolism and metabolic system. So definitely there are associations, but still we cannot say how the exact mechanisms are happening, between different nutrients and alcohol. So definitely we should avoid it. That should be the take home message.
True, very true. Thank you so much for adding this point. Jyotis will be the last question, and if any audience having any students of our organization wants to add any question, we will obviously take, because we have not taken any students' question yet except Sneha. So alcohol related to liver disease receives 10 times less attention it deserves. Every year, 1 lakh people die in India due to the liver failure, of which significantly proportion suffered from alcoholic liver disease. However, in the last few years, initiatives have been made to develop newer therapies. So, stool microbiota transplant has been studied in patients with alcoholic hepatitis with promising early result. Yes, very nicely said by Jyoti ma'am. And more, I want to add that one thing is very much neglected in our countries, in our states, that is the fatty liver grade 1. When the elevated SGOT, SGPT levels, the doctor just give it, oh, it's very common. आपका थोड़ा फैटी लीवर है, आप खाना वाना ठीक करो, एक्सरसाइज करो, ठीक हो जाएगा. सो वी आर नॉट टेकिंग अ डिटेल हिस्ट्री, एंड इवन इन ग्रेड 1 फैटी लीवर द पीपल यूज्ड टू टेक अल्कोहल, एंड धीरे धीरे मैंने मेरे आंखों के सामने देखा है. एंड आई डोंट नो द डायरेक्ट रिलेशन, इवन 2-3 पेशेंट्स आई हैव ऑब्जर्व फैटी लीवर के साथ साथ अल्कोहल, एंड उसके साथ बहुत ज्यादा कम विटामिन डी लेवल, दैट इज 6 or 7 or 10. So I will say the dietitians, if you are getting any fatty liver patients, so please just give them warning about changing their lifestyles. You don't know how can fatty liver be converted into aggravated liver diseases or cirrhosis or anything. So fatty liver grade 1 at first stage, reduce the weight, at least 10 to 15% of the weight loss is required. Abdominal obesity should be reduced, and carbohydrate rich foods like simple carbohydrate should be reduced. One more question, Moumita, I can just add, I can ask you that if the patient's triglyceride level is elevated, high triglyceride level, and patient is on alcohol, regular basis alcohol, so what should be your say if the HDL is okay and the total cholesterol is even in the normal range, only the triglyceride is high?
I think firstly the modified their diet and cut down the simple sugar, which can elevate the triglyceride levels.
Actually, it is not the fat is not the culprit here. Here the culprit is the carbohydrate for the elevated triglyceride level. As you know from your biochemistry, that you should first cut down to simple sugar and also reduce the total carbohydrate. If the patient is taking 65% or more of carbohydrate, you should cut down to 55% or less to just check the triglyceride, and especially the simple carbohydrate, totally no. And cutting down the sugar is very so alcohol is full of calories, alcohol is full of empty calories. So obviously, Moumita, as per Moumita, we should cut down to like alcohol. If the patient is without medication, so obviously we should, if the patient is taking statin with fenofibrate is the molecule which is used to reduce triglyceride level. So fenofibrate should be initiated, and along with alcohol should be reduced, or you should cut down. Yeah, Khushbu and Arpita.
Yes. Sir, actually, I just wanted to add something that when we were talking about the doses that we should tell the patients if they are coming up with a question, because in general, because working with Goki, I do get these questions generally in the weekends. They'll come up and ask you, kitna lena chahiye? And of course, as Ranjeeta was saying, restricting is important, but then practically, if we cannot cut 30 ml ka half, we cannot do. So what I have seen practically is if you tell them to have 2 drinks, 60 ml, which is also, we can see different studies as restricting to 2 drinks as well, can at least wo jo bahut zyada over drinking that happens, that they are taking more than 4 drinks in between 3 to 4 hours, that will at least come down. So telling the patients to restrict to 2 drinks, that is 60 ml, is something that's very practically possible. They are able to do that.
and वो trust भी धीरे build up हो जाता है, and then later we can bring it down further.
Yes, and you have to explain what is this true drink thoroughly. Even
Yes.
Khushbu, before 1 or 2 days, just I was surfing net. I was not in intention to go through, but I got a doctor's video in YouTube. So the doctor is a cardiologist and he is recommending about American Heart Association. He's a Bengali doctor. I was scrolling something and I got this video. I have saved it or not. So the doctor is saying no true drink, no one drink for the cardio patient if there is post-OT patient, or if the patient is having severe cardiac problem, or the patient is having elevated cholesterol level, there is no drink, not two drink or not one drink. The doctor is suggesting no drink. So maybe any guideline has changed or not from the American Heart Association. We need to check that.
Even sir, for gut related issues the patient are having, for them also we have to make them understand to stop it completely, because
Yes.
then the whole treatment procedure changes when they are consuming alcohol.
Yes, but Shomam, have you given any point? Yes, we should recommended multivitamin mineral tablet if you have identified any specific thing, but definitely B vitamin and D vitamin level should be checked and monitored, especially B1, B2, and B3. Yes, very good. Thank you so much for the input. Skipping dinner after taking alcohol can be a consequence. Yes, obviously, and if it is a type 2 dinner, type 2 diabetes patient, obviously it will be a great concern. Arpita, I will be taking your question as the last question. Arpita Sharkar.
Yes, sir. Good evening, everyone. I would like to thank you and congratulations to all the speakers. And my question is that if a person will go for weight loss journey, then he or she will take alcohol and how much and which brand is recommended for them?
No brand, we cannot say any brand or any types. Fatma, what is the question? Where is traveling? Person is traveling. Arpita?
If the person is on a weight loss journey.
Weight loss journey. Okay. So weight loss journey, suddenly if we say the person to take red wine, the person will not switch to red wine or white wine. But we should not recommend to take the person beer, and we should limit that. Obviously, when you are planning a diet chart, maybe it is a 1600, 1800, 1400. In that diet chart, you have to calculate the calorie of alcohol as well to fit into that. 1600 के ऊपर 300 या 200 calorie extra she is taking, Arpita, we will not guide in this way. If the person is some days taking, what should be altered, how much calories should be adjusted, that should be given to the patient. That guideline should be given to the patient. So that is the thing I can just add on. We have crunch time. Huh. Okay, I will give this explanation, Arpita, obviously personally if you call me. So for patient specific, I will thoroughly explain you how to manage this type of patient with the calorie.
Okay, sir. Thank you.
Okay. Bye everyone and good night. We are coming with rheumatoid arthritis and child obesity, two important topic. By next week, we have a very important topic, that is South Indian cuisines, South Indian foods, that how it is controlling many diseases, and the traditional, we are losing the tradition of eating our traditional food, how traditional food, we can come back with the traditional food. So we have some South Indian student in Cognized Nutrition. So mid of July, we will be coming with many interesting topics, which are coming in my mind, even students' mind. So, and if you have any suggestions for any topic from the audience also, we will try to cover that topic. So thank you so much and good night, everyone.
Thank you, sir.
Thank you, sir. Thank you, everyone.
Yeah, thank you. Good night.
Thank you, sir. Good